Good afternoon, everyone. I know that people have been dealing with a lot the past few years with COVID. It's been difficult for our health, the health of the community. It's been difficult for the health of the economy. It's been difficult for so many frontline workers in all kinds of professions. It's been difficult for people's mental health. And now we have this other virus that seems to be spreading elsewhere. And I want to be very clear about what monkeypox is, what it isn't, especially given the WHO designation, and what we're doing, because we're working very hard, Mayor Turner and I, with all of our partners in our community to make sure we stay in front of this. So I'm going to give Mayor Turner an opportunity to speak first. I know he has to leave soon. Then I will share my remarks, and we'll have other folks share remarks as well. Mayor Turner.
Thank you, Judge, and it's good to be, to be with you and standing with you. We stood together dealing with COVID, and we're still facing COVID, and now here we are dealing with monkeypox. So let me just say, the city of Houston and Harris County will continue collaborating on a strategy to address monkeypox vaccines and testing for at-risk populations. It was a positive step by the World Health Organization to declare monkeypox a global public health emergency, and I want to assure you that the City of Houston and Harris County are taking this matter extremely seriously, recognizing that this is a public health emergency. We announced last Friday that the Houston Health Department received slightly over 5,000 doses of the monkeypox vaccine. The delivery of the doses allocated by the Center for Disease Control and Prevention and the Texas Department of State Health Services will allow more vaccines to become available for Houston and Harris County residents at the highest risk of the disease. The Health Department for the City of Houston kept about 3,500 doses and provided more than 1,500 doses to Harris County Public Health. It is a 2-dose series, 4 weeks apart, for prevention if someone has been exposed. It's best to start the series of vaccines within 4 days of exposure. As monkeypox cases continue to increase, it is extremely important that Houstonians know that the community threat level to the general population continues to remain low, but the number of cases in the Houston area is rising. And because of the limited supply of the vaccine, it is still very concerning. If you think you have monkeypox symptoms, please speak first with your doctor and get tested. The Houston Health Department announced the city's first confirmed case of monkeypox on June 18th. The case count rose gradually over the following weeks, and none of Houston's monkeypox cases, well, they would say at least one, has required hospitalization, and that was primarily for pain management. Houston currently has 47 confirmed cases. At least one has required hospitalization, and these persons are not severely ill, just isolating to avoid spreading the infection. However, this case count is likely to increase based on what we know has happened in other cities. Monkeypox is a rare virus and does not spread easily between people without close personal skin-to-skin contact. There is a limited supply from the Center for Disease Control and Prevention, the CDC, and widespread vaccination is not recommended at this time. Due to the limited national supply, the vaccine is not yet widely available to everyone. The focus of vaccine availability is people with a likely exposure to a confirmed monkeypox case. I will close by saying that the Houston Health Department is doing everything possible to increase the supply of vaccines. As Judge Hidalgo will mention shortly, we are sending a joint letter to the White House and CDC asking for more vaccines to meet the anticipated need of the Houston-Harris County region. And we need them to please send us more vaccines before the numbers exponentially increase. We are the fourth largest and the most diverse city in the country, and we need more vaccines. We all can learn from what happened in COVID. If you wait too long, then you're chasing after a pandemic. And in this case, we don't want to wait until the cases become so many that we find ourselves behind the 8 ball. So we are asking the CDC and the White House to send us more vaccines. Last week we received over 5,000. Hopefully in the next week or two we will receive at least that amount, if not more. I certainly want to acknowledge Europa Harris with Congresswoman Sheila Jackson-Lee's office. I know I've been in communication with her, and she is doing everything she can to assist us as well. But Judge, thank you for your leadership. Look forward to working with you and with all of our health providers in making this happen. I know in addition to the city of Houston and sharing with Harris County, I know we're also making vaccines available to some of our partners as well. I had that list before me, but I'm sure Director Stephen Williams will mention this shortly. Thank you, Judge.
Thank you, Mayor. Thank you. So as folks know, it's been a long road with COVID, and we're having this conversation today not to try to burden people, not to make people scared, but to get to work, to proactively work on making sure that this takes a different trajectory, to inform folks of what we need to be doing. Saturday, the World Health Organization declared the monkeypox virus a global public health emergency. As of last Friday, the United States had approximately 2,900 confirmed cases. Of those, Texas has about 183, and Harris County has 57 confirmed, including the city of Houston. As of today, Harris County has 10 cases in unincorporated Harris County outside the city of Houston. All have been men between the ages 20 to 58. I want to be very clear about this. The risk in Harris County right now remains low, even though it has been spreading in other countries, in other cities. If we look at the rate of infection in Harris County, and in Texas for that matter, it's lower than it is in other states. So we're in a perfect time to lean forward, to prepare, to do everything we can to try to stop this as much as we can, minimize the impact that this has. To be clear about what monkeypox is, it can look like a pimple or a blister or a rash and a lesion, sometimes a few small bumps. Some folks experience fevers, headaches, before they begin seeing the lesions. And so even, especially now that we have such high case counts of COVID, folks might think that they have COVID, folks might think they have a cold, and then they'll begin seeing those lesions. Why is monkeypox concerning then? Monkeypox has spread out of Africa where it's endemic and has come to the United States before, but never to this kind of extent. We're seeing a lot of transmission. Case counts are rising. We're seeing that not just in the United States, but in other countries. And that's new, even though this disease has been around for many decades, this virus. Now, the good news is that this is a virus that already existed. It's a known virus. There's a vaccine already. The smallpox vaccine, which was developed many decades ago, has been shown to work against monkeypox. It exists, it's available, it has a technology that was developed a very long time ago. There are treatment options already available. Now, the challenging news is that it can cause certain areas of concern, particularly for the immunocompromised, particularly for children. And there's some things we still don't know about what the impact of this virus could be in the community. And from the experience with COVID, those unknowns, right, are the concern. So there are certain groups right now that are at higher risk. We know nationwide, and even here in Harris County from what we've seen, men, particularly men who have sex with men, are at higher risk. Second, and most importantly, anyone can get monkeypox. that is not limited to any one population. Just this Friday, we learned of the first 2 children that were diagnosed with monkeypox. HIV/AIDS was underestimated by the public and stigmatized by the community and by the media to some extent, because initially it impacted just a certain population. Because it was ignored, because it was stigmatized, it quickly spread through the other groups, ultimately causing a crisis. This time it's different. We have a playbook. We have lessons learned. We understand how disease spreads, and we need to understand that this virus is not just limited to one community, and we have to make sure that we don't fall into that same trap. Now, here's what we're doing. We're doing our due diligence to learn as much as we can about the virus and to learn about what other jurisdictions are doing. Just this afternoon, before the press conference, I was on the phone with officials from Cook County, from Chicago. They've been seeing cases a little longer than we have. They have more experience as to what's happened, what to do, what are some lessons learned. We're working together, the city, the county, our officials, our hospital systems, and we hope to bring the community along in those efforts as well. We're working with our jail. I spoke with Sheriff Gonzalez this afternoon as well to make sure that we're increasing screening, and that folks that are looking after that population are aware and leaning proactively. We're getting testing and vaccination ready, contact tracing. We already have city and county contact tracing, testing, and vaccination capacity, but we're working to create a process for more of each of those as more becomes available and as demand increases. Here's what we need the community to do. Act now. If you have a new or unknown lesion, assume it's monkeypox and go and get it tested. Limit intimate and sexual contact with anonymous partners. If you believe you need the vaccine, contact Harris County Public Health or contact the Houston Health Department. The phone numbers are 832-927-0707 and 832-393-4220. ReadyHarris.org will always have the latest information. Folks who've tested positive for monkeypox need to isolate until all lesions have completely healed and a new layer of skin has formed over. As far as testing, where can people get tested? This is different from COVID in the sense that you can get tested with any provider. Your provider should have a contract with the laboratory, and they can take that swab of the lesion, that's how the testing works, and send that sample over to a laboratory provider. So right now, we're not seeing that limited capacity when it comes to testing. If you don't have insurance, if you don't have a provider, you can contact our public health departments and we can help get you tested, whether it is via our departments or whether it is helping you pair you with a provider that will not charge a fee and that doesn't require insurance. So again, those are the same phone numbers. On vaccines, a bit of good news and a bit of bad news. The good news, as I mentioned, there is a vaccine already available. It's a vaccine that's tried and true. That smallpox vaccine, and it's very, very well developed. The challenging news is we just don't have enough, just as the mayor said. So right now, where we've seen just a few dozen cases, the vaccines we have available may be enough. But as this spreads in a community as large as ours, we don't want those vaccines to be a limiting factor. And so the people who qualify right now, individuals who've had a contact with a presumed or confirmed monkeypox case, as soon as a provider tells us that someone has monkeypox, we contact those that they've had that intimate contact with, and we get them vaccinated. So that's one group. Individuals who had a presumed exposure because they know that a sexual partner in the last 14 days was diagnosed with monkeypox. Those folks can get the vaccine as well. Or someone who has had multiple sexual partners in the last 14 days. Those folks are eligible for the vaccine. The concern is, of course, the mayor mentioned these 3,000 doses. Each vaccine round, each full vaccination is 2 doses. So really that leaves us with just over 1,000 vaccines for the entire population. And that is why we're saying we need more supply of vaccines before we end up in a situation where those vaccines are the limiting factor. So Mayor Turner and I are asking that the federal government quickly procure and allocate more vaccines to our region. We understand that the regions that are seeing higher case counts right now are getting the bulk of the vaccines. What we want to appreciate is that we have an opportunity to leapfrog ahead of this virus, to try to mitigate it in a way that we couldn't do with COVID because we didn't have vaccinations at that time. Our mission, my mission, will be to fight this virus with information, to fight this virus with transparency, to fight this virus with the best health information and tools that we have. And we're going to continue doing that alongside the community. I will keep the community informed as we have any developments, and we will be pushing for more resources for Harris County and for Houston. We're in touch with our congressional delegation. I know they only want what's best for our region as well. But right now, we can make more of a difference and mitigate this before it becomes a serious threat to the community by each of us doing our part. Making sure that you get tested if you think at all that you may have monkeypox, and that could be any sort of unknown or new lesion. Making sure that you call us if you believe you qualify or need the vaccine, and to limit that intimate contact. And to be very clear, not just sexual contact, just touching the skin, kissing. That can transmit the disease, so limiting that intimate sexual contact with anonymous partners or anyone that you think may have monkeypox. So with that, let me repeat in Spanish, and then I'll pass it on to our colleagues here, and we'll all take questions. Primero le quiero agradecer al alcalde Turner el poder trabajar mano a mano con él. Durante esta crisis del coronavirus nos ha permitido la oportunidad de presentar las mejores soluciones para nuestro condado, y estamos trabajando muy de la mano también con este virus y la viruela del mono. Sé que en general la comunidad ha pasado por muchos retos con el COVID. Que el COVID fue impactante, negativamente en cuanto a la salud de la población, la salud mental de la población, la salud de la economía, tantos retos que sigue presentando el COVID. Y ahora un nuevo virus, la viruela del mono. No queremos asustar a la gente, no queremos preocupar, queremos actuar. Queremos empezar a trabajar para que este virus no tenga el mismo impacto negativo en nuestra comunidad que tuvo el COVID, o que continúa teniendo el COVID de varias maneras. El sábado, la Organización Mundial de la Salud declaró una emergencia de salud pública global en cuanto a esta viruela del mono. El viernes que acaba de pasar, tenemos aquí en el condado Harris 57 casos confirmados. 10 fuera de la ciudad de Houston, y la gran mayoría de los 47 dentro de la ciudad de Houston. De los 10 casos en el condado Harris, fuera de la ciudad de Houston, todos han sido hombres de 20 a 56 años. Quiero ser muy clara. Aunque la viruela del mono se está extendiendo alrededor del mundo y ha llegado ya a nuestra comunidad, el riesgo de contagio, de propagación, es limitado y leve en el presente momento dentro del condado Harris. Eso no significa que no vamos a estar alerta. Para ser muy claros, ¿qué es la viruela del mono? Puede ser una espinilla, una ampolla, protuberancias, cualquier lesión en el cuerpo, en la piel, puede terminar siendo viruela del mono. Puede ser una reflexión de la viruela del mono. Algunas personas sienten síntomas como de un resfrío antes de que aparezcan esas lesiones. Entonces hemos visto que hay pacientes que se empiezan a sentir con fiebre, síntomas de resfrío, creen que tienen COVID, creen que tienen de repente la gripa, y resulta siendo la viruela del mono. Ahora, ¿por qué nos preocupa? Porque especialmente los niños, personas inmunocomprometidas, pueden tener impactos más negativos por parte de este virus o debido a este virus. Las buenas noticias es que este virus ya se conoce. Este virus ha existido en África desde hace varias décadas. Las buenas noticias es que ya hay una vacuna. Es la vacuna que se ha utilizado por muchas décadas también. Las malas noticias es que esto se está expandiendo de una manera que nunca antes había sucedido. Sí había llegado antes el virus a los Estados Unidos y a otros países, pero no hasta tal nivel. Entonces ese contagio nos preocupa, ese contagio es algo que todavía no entendemos y al no poderse entender, entonces viene siendo preocupante. Hay ciertos grupos que sabemos que están a más riesgo de contraer la viruela del mono hoy día. Los hombres que tienen sexo con hombres específicamente están siendo impactados desproporcionadamente. Ahora quiero ser muy clara y esto es importante. Eso no significa que los demás grupos no pueden contagiarse. Ya tuvimos esta experiencia con el SIDA y el VIH, cuando empezó este virus con ciertas poblaciones y los demás empezaron con el estigma y asumir que el virus no los podía tocar a ellos. Hoy día la mitad de los casos de SIDA y VIH están en mujeres y personas que no son hombres, que tienen sexo con hombres. Entonces, no cometamos los mismos errores. Recordemos que este virus algún día, esperemos no muy pronto, pero lo más probable es que suceda, que se pueda expandir a una población mucho más amplia. Entonces, ¿qué estamos haciendo nosotros? Estamos haciendo nuestra debida diligencia para prepararnos. El día de hoy estuve en comunicación con oficiales en el condado Cook, en Chicago, donde ya han tenido desde hace tiempo, un poco más tiempo, esta viruela del mono, para entender qué recomendaciones tienen. Hemos estado trabajando juntos, el condado y la ciudad, con nuestra cárcel también, con el alguacil González, para asegurarnos que estamos haciendo pruebas ahí, el equipo de investigación. Estamos trabajando en desarrollar las pruebas, las vacunas, monitorear los casos y también crear un proceso más definitivo para poder expandir la capacidad de pruebas, de vacunas y de análisis de casos. ¿Qué necesitamos que haga la comunidad? Número uno, necesitamos que limite el contacto sexual e íntimo con parejas anónimas. Si no conoce la persona con quien está teniendo ese contacto sexual, ese contacto íntimo, absténgase por este momento. Y ese contacto íntimo significa también el besar, el tocar la piel. Simplemente tocar esas lesiones puede esparcir el virus. Número dos, si tiene alguna lesión nueva o desconocida, asuma que es la viruela del mono y hágase la prueba. Es simplemente una muestra de la lesión. Finalmente, si cree usted que necesita la vacuna, llame a la ciudad de Houston o al condado Harris al 832-927-0707 u 832-393-4220. Las personas con una prueba positiva de viruela del virus deben aislarse hasta que las lesiones se hayan eliminado por completo y haya nueva piel encima de donde estaban las lesiones. Las pruebas, todos los proveedores deben ofrecer pruebas. Si no tiene seguro médico, si no tiene un proveedor, contáctelos al Departamento de Salud Pública. Las vacunas no hay suficientes en el condado Harris. Por ahora le estamos ofreciendo la vacuna a aquellas personas que han tenido contacto con un caso de viruela del mono o individuos que saben que una pareja sexual en los últimos 14 días ha sido diagnosticada con la viruela del mono o alguien que ha tenido múltiples encuentros sexuales en los últimos 14 días. Nos puede contactar también si cree que es elegible para la vacuna. Estamos pidiéndole el alcalde y yo más vacunas al gobierno federal. Estamos trabajando con nuestra delegación del Congreso. Si recibimos esas vacunas, vamos a poder de alguna manera mitigar los impactos de este virus de manera que no pudimos hacer con el COVID. Entonces, lo dejo así. Vamos a trabajar juntos en esto. No es momento para alarma, es momento de trabajo. Vamos a trabajar juntos, seguir marchando y seguir mitigando el riesgo de este virus. Ahora, I'm going to introduce Legacy Community Health Infectious Disease Specialist Dr. Vandana Shrikant, who will speak, and then we have Houston Health Department Director Stephen Williams here. Thank you, Dr. Williams, for joining us, as well as Harris County Public Health Executive Director Barbie Robinson and our local health authority for Harris County, Dr. Erica Brown, who will be ready to answer questions. Yes.
Just give me 1 second. Yeah. Because I forgot to mention two things. Well, the City of Houston's Health Department, we are prioritizing two groups for the vaccine. One is the group that Judge just spoke about, individuals who are high or intermediate risk exposure with someone with monkeypox, or people who attended an event or venue with high risk exposure. And the second group are adults diagnosed with specific sexually transmitted disease. So that first group is the number one priority. And then the second group are those adults diagnosed with specific sexually transmitted diseases. Of that 5,000 vaccines that we received, in addition to providing doses to Harris County, we provided doses to Be Busy, to Legacy, and to Dr. Joseph Gatt. And then lastly, for more information, you can reach us at the City of Houston Health Department at 832-393-4220. Thank you.
Hello, everyone. I'm Dr. Vandana Shrikant. I'm the infectious disease specialist at Legacy Community Health. And I want to reiterate what Judge Hidalgo and Mayor Turner has told us now, that this monkeypox virus is not a new virus. We've known this. It's been causing infections, and it's endemic in Africa. But what we need to do now, the takeaway message now from this meeting is that do not panic, right? This is not the time for us to be alarmed, but this is time for us to be informed. And another thing, very important thing is, since we're seeing most of the cases in a certain community, in men who are having sex with men, and in people who identify themselves as bisexual, please do not, let us not stigmatize this population, and let us not discriminate against this group of people. So that is an important message that I want to share with you all here today. So this is a monkeypox virus. It's not an STD. It's not a sexually transmitted disease, but it is transmitted through close physical contact, through skin-to-skin contact or direct face-to-face contact. And this can occur during a sexual activity. So that is why you might see this after a person has engaged in close activity, such as a sexual activity. But it is not an STD, and this another important thing is this is not an airborne disease. So what does that mean? This does not travel long distances, and it is not as transmissible as COVID-19 virus. So let us not be scared. What we need to be is gain as much knowledge as possible, right, and educate ourselves, educate our population around us. And what are the important steps to prevent getting this monkeypox virus? Avoid close skin-to-skin contact with people who have a rash that looks like monkeypox. So do not touch this rash or scabs of a person with monkeypox. Do not kiss, hug, cuddle, or have sex with someone with monkeypox. Do not share utensils or cups with a person with monkeypox. Do not handle or touch bedding, towels, or clothing of a person with monkeypox. But because this is through close contact and droplet infection, do not panic about sharing the elevator with someone who might have a lesion, or do not be afraid to stand in the grocery line thinking someone with a lesion that might look like a monkeypox, and you're going to be infected with that. Wash your hands as often with soap and water, or use an alcohol-based sanitizer. So now we've already heard of some of the symptoms of monkeypox, right? So this is just to reiterate what we've already heard. So the initial phase might be like a flu-like illness. Patients might present with fever, exhaustion, headache, body aches, or swollen lymph nodes. And this is called the prodrome phase. And then they might start developing the rash, the characteristic rash of monkeypox within 24 hours of developing these symptoms. So the rash might look like pimples initially, and they might go through different stages. Like an initial pimple, then it might look like a boil, a pussful boil, like a pustule, and then it might start to scab, like form a crust. So during all these stages, the rash might look like a pimple, a boil, like which could be like a staph infection, or it could appear like herpes, and some of these lesions can even look like syphilis. And most of this, the rash might appear on the face, on the extremities such as your palms and soles, and also in the genital area and the anal area. The rash goes through these different stages, and it might take up to 2 to 4 weeks for all the stages to be completed in a person. And the person is considered to be infective to others as long as all the lesions scab off, the scabs fall off, and there's a new skin formed in its place. Sometimes patients might not develop the prodrome, and they might come up with just a rash. The rash might be just a few, and patient might present as like, it started off as a pimple, and now it looks like a cold sore. That might be the presentation. So what do you do when you see a rash? Please contact your healthcare provider. While you're waiting to see your healthcare provider, avoid contact with others. avoid contact with even close people, and make sure your rash is covered. Once you get your appointment, and while your provider is testing, again, be cautious, avoid people again, and wait patiently until you get your results. If you test positive for the monkeypox, then you'll have to be isolated until all your lesions fall off. And so that is very important. So one is, once you have the lesions, contact your provider and be honest with your provider that what have your high-risk activities been that you think this could be monkeypox, right? Your provider might not know what you've been doing in the last 2 weeks, right? So be honest with your provider, reach out to your provider, and get testing done. And like we've already know, there's some vaccines available, and this is what we really want now at this point. Knowledge, be informed, get tested, and isolate if you're positive. Thank you.
We'll take any questions.
How
Yes.
many vaccines do you have on hand right now?
Currently in Harris County, we have 799 total vaccines. If you count, you need 2 doses to get the full course. That's for unincorporated Harris County. The city of Houston has more because they've had the bulk of the cases. So the vaccines have gone from the state to the city of Houston, federal government and the state. The city of Houston has distributed some of us to Harris County, and we reached the agreement to have the bulk of them go to the city and a chunk of them to Harris County. As we receive more shipments, we'll reallocate. I'll let the mayor answer the city numbers.
The city of Houston has about 3,500, and again, 2 doses, so divide that by 2. Okay, about 3,500. The hope is that CDC will be sending us more, and that's for the reason for the joint letter. We need more. And when you see what's happening in New York, D.C., San Francisco, Chicago, this is the 4th largest city, the most diverse, and we've gone from 1 to 20 to 35. Now we have 47 cases. So our numbers, though small, are increasing. We want to get ahead of it, and we want to be able to provide vaccines just beyond that top priority group, okay? So we are encouraging the CDC to send us more.
So I just a little back the envelope math here. So about 800 for Harris County, 3,500 for you guys. So there's another 700 out there. Where did those go, and are those already distributed?
And then we distributed some to Be Busy, to Legacy, and to Dr. Joseph Gaff.
Okay. So and how many of those have been administered of the 5,000? Does anyone know?
Repeat that question one more time.
How many of the 5,000 vaccines have actually been administered to patients?
Under 200.
Say again?
Under 200.
Under 200. Thank you, sir.
And I'll let Director Robinson or Dr. Brown clarify if I'm mistaken here, but the number, so Mayor and I gave numbers and come from different directions. So he mentioned the number of doses, and I mentioned the number of full courses. So for Harris County is 709 times 2, and so that's why the numbers, that's the difference.
Oh, so
Yeah.
799 is total courses?
Exactly. So
Okay.
you multiply that by 2 on the number of
Okay,
doses.
so you actually have 1,600.
Yes, because
So-
I just don't want, I want folks to know that, the number might seem a little bit bigger than it really is because we have to save half of them for the second dose. And it's 4 weeks between the first dose and the second dose. And that's the thing is as people come forward that may have those close contacts with people who have been diagnosed with monkeypox, we want to be able to vaccinate them. And that's what we need to be able to get ahead with, but we don't want to have that limiting factor of not having enough vaccines. And I'll tell you guys from speaking to my colleagues around the country, that is what they're bumping up against. So it's not a matter of if, it's a matter of when, and we want to be able to get ahead, which is why we're calling attention to this now and sending the letter to the federal government now.
And at the same time, as I just said, at the same time, we don't want vaccines just to remain on the shelf. So we're going to be monitoring things very, very closely. So we have those priority groups, okay? Those who have been exposed, high-risk exposure, those who may be dealing with sexual-oriented diseases already. But we don't want vaccines to remain on the shelf. So we'll be monitoring things closely. but where we can get them out to try to get in front, to keep the numbers from exponentially increasing, that's what we will do. And that's why I'm really pushing hard for the CDC to send to Houston Harris County more vaccines. Let's not wait until the numbers really start to grow and then send us vaccines to try to get back in front of this train.
So a couple of other questions, if I may, and these are from some other reporters at our shop, so it's a little bit of a hodgepodge here. But so we've had reporters who have gotten complaints from medical providers who feel like that they aren't getting direction from the Houston Health Department, little to no guidance, filling out 5-page long forms, but not getting answers. So the question is, what specific communication have you had with area medical providers? Do you have any proof to that you provided that information?
The short answer to that is yes. As a health department, one of our responsibilities is to provide consultation to providers within our jurisdiction. Our staff have actually had sessions with medical providers. We've also elicited a number of providers to take folks in that do not have medical homes. We've also had roundtables with community groups just to provide outreach and education. And you can go to our website where we do have a document that speaks to all of this.
Can you, I think what they're asking for is, can you give, name names, give us an idea of which organizations, that kind of thing that you've spoken to? And
Actually, I can give you a handout if you want it.
Thank you. And I guess one of the concerns has been, for example, one of our reporters interviewed somebody who ticked all the boxes in terms of exposure and all these sorts of things, but could not get the vaccine shot. A gentleman named Daniel, maybe you saw that.
That is exactly what we're dealing with and creating that Category B. Because initially, because we looked at the scarcity of vaccine, our criteria was narrow. It was actually following the CDC's initial guidelines. And as we began to look at that, we actually expanded it. Just by the experience we were having, we really had to expand it just because of contacts that were not necessarily identifiable. And so we went to a specific venue to hold a vaccination event because we knew that people who were at high risk had actually visited that venue.
Oh, so you went to the venue where there was exposure?
Yes, we did.
Okay, all right.
Director, I have a question here in the back. Could you talk about the fine line of putting out, trying to get awareness without stigmatizing a specific community? I know globally the numbers that we're seeing, bisexual men, men who have sex with men seem to be most disproportionately affected by monkeypox. Could you talk about that?
You know, that in fact is a challenge. Just because you're an MSM doesn't necessarily put you at high risk. It is about the behavior that you engage in. I think that the speakers earlier referred to that. It is about the specific behavior. Just because you're an MSM or whatever doesn't necessarily put you at high risk. And that's really what the question was speaking to earlier. Our epidemiologists actually went through an algorithm to determine whether or not that individual was at high risk. I think we have to acknowledge that because there is a level of fear within the community, when we start talking about just generally, that people become fearful, when in fact they might not be in a high-risk category.
Can you talk a little bit about wastewater and how that, they COVID tested the wastewater here in Houston. Is it something similar to what you have in Monkeypox soon, or is it already?
We're not doing that currently. Is it possible?
There are jurisdictions that have
This is
looked
Dr. White.
Yes, good afternoon. There are jurisdictions that look at different viruses in wastewater, so our department is looking at different options, but to say at this time that we've got a number to tell you in wastewater, we're not doing that right now.
Is there like an estimation as like when you may start?
I'll answer that.
Yeah.
That's a money question, actually. So, certainly, as a health department, we would have an interest in doing that. But if we had the resources to do it and it was possible and our lab had the capacity, we would probably do it. On a long-term basis, we are actually looking at wastewater as a broader surveillance activity because it has really been helpful during COVID. I can't go in any environment or convention without someone mentioning it. And so we're really looking at what the broader universe would look like in terms of using wastewater as a more general surveillance tool.
With the WHO designation of the global health emergency, does that impact any kind of change either at the county or the city level in terms of response?
And part of what it was is sending a message to health departments all throughout the world to really take this on. And of course, all of us had been preparing. We'd been working just this past week at Commissioner's Court. We took unanimous action related to coronavirus and monkeypox. We just have been working with our emergency operations team as well. They've been running scenarios. The coordination has been happening on monkeypox. But I think that signal, it's important to really hear it not just as departments and government, but as a community. And that's why we want to have this press conference today, is to communicate to the community, look, we're going to advocate for Houston and Harris County to get those vaccines. We're going to work with our partners to make sure that testing is accessible, and it already is out there, but that it's more accessible, that vaccines are more accessible, that treatments are more accessible. But to the extent that the community can follow those simple steps now, it'll help buy us some time, make sure that we can observe what's happening in other jurisdictions, we can get more vaccines over here, and then it's about action. It's not about fear. It's about getting things done, working together, getting ahead of this, and just getting it done. That's the point we're in now.
Of the numbers that you gave for the, those infected in Houston and Harris County, are those all current infections or since the outbreak? I guess the question is, any recoveries in that number?
I'll give Dr. Brown, go ahead.
Yes. Good afternoon, Dr. Brown, Local Health Authority for Harris County Public Health. Those numbers are cumulative, so since we've seen our first cases, the county as a whole has seen a total of 57 cases. Harris County unincorporated has seen 10, and Houston has seen 47.
And of those, any recoveries at all, or everyone's still sick? All 57 people still sick?
So the course for most in general, and that's a good point, thank you, the course for most is self-limiting. Most people will recover and lesions will completely heal within about 3 weeks. So yes, there have been most recoveries. I think as Mayor mentioned, we do have one person in the hospital at this time, but that's for pain management because the lesions can be quite painful.
And I also want folks to know we do have that data available right now, and we'll work, and it's online, and there's a link, there should be a link right now in Ready Harris, but certainly it's our Public Health Department website. And to the extent that we have more data, we'll have more information. Right now, for example, we're not offering geographic information for privacy reasons. Just as if you'll recall at the beginning of COVID, we had such small cases, we didn't want folks to be identifiable. But we are offering information as to the numbers for both the city and the county, and we're going to continue to, as always, err on the side of transparency with this.
Pues la comunidad pregunta si hay algún tipo de riesgo en los niños de la zona. Sabemos que hay 2 casos reportados a nivel nacional. ¿Hay riesgo para los menores de edad de encontrar este virus?
El riesgo para la comunidad hoy día es leve porque el número de casos es limitado. El contagio ocurre, como explicó la doctora, ese contagio específico con las llagas, con las lesiones y además o contacto sexual. Entonces, el riesgo para los niños es básicamente si un padre, si una persona con quien tienen contacto muy cercano tiene la viruela del mono y tienen ese contacto con las llagas en sí, lo cual, dado que hay el número de casos es bajo, la probabilidad de que los niños resulten con el virus hoy día aquí en el condado Harris es muy, muy leve. Ahora, no significa que no pueda suceder. Como expliqué el viernes, se identificaron los primeros 2 casos en niños en los Estados Unidos. Y la preocupación con los niños es que puede causar problemas en el cerebro, lo que es el encefalitis, es lo que pueden tener los niños por causa de este virus. Entonces, por eso hay que estar alertas e intentar contener ese virus antes de que pueda presentar un reto a la población en general. Pero hoy día, padres de familia, no hay por qué estar alarmados, es simplemente aquellas personas que tengan alguna lesión, alguna llaga nueva que no entiendan, por favor, ir al doctor. Eso es lo número 1. Y número 2 son las personas que saben que es muy probable que tengan la viruela del mono, que nos llamen para recibir la vacuna.
Las vacunas son gratuitas.
Las vacunas son gratuitas y las vacunas se administran a través de nuestros departamentos de salud pública o hay ciertos hospitales que también se les han ofrecido las vacunas.
Autoridades del condado y la ciudad ya han tenido algún acercamiento. Sabemos que este problema, por lo que han dicho, es principalmente en las comunidades LGBT o las personas homosexuales o bisexuales. ¿Han tenido acercamiento con esas clínicas o esos centros de atención para ese sector de la comunidad para alertarlos, para tratar de alertarlos?
Absolutamente. De hecho, la doctora que habló, ella trabaja en una clínica que específicamente trabaja con aquellas comunidades. Estamos diariamente en contacto con las comunidades a más alto riesgo para ofrecerles a aquellas personas que hayan sido expuestas al virus, ofrecerles la vacuna, para ofrecerles la prueba, pero es importante ahí también recordar que eso no significa que este virus no pueda contagiar a una persona que no sea miembro de esas comunidades. Es ahí donde pues, construye esa conexión con el SIDA y el VIH, que en un principio era solo en tal comunidad, hoy día puede afectar a cualquier comunidad.
Por último, de las 5,000 vacunas recibidas, ¿cuántas se han aplicado hasta el momento?
Déjeme conseguirle el número adecuado. Creo que han sido 200 vaccines that have been administered up till now, you said? Yes. Menos de 200 en este momento.
Entonces,
Menos de 200 vacunas se han administrado hoy día.
And I'm sorry, just so that I'm clear, that's an individual shot, not a complete dose?
Sí.
Okay, so you will need another, say, 200 or so
Sí.
to complete the dose?
Y sí, para ser claros, la vacuna en sí son dos dosis con 4 semanas por medio. Entonces, ya hemos administrado 200, hemos tenido que guardar 200 más que las estamos reservando para la segunda dosis de esos pacientes. Y las demás, pues estamos pendientes a ofrecerlas a cualquier contacto de personas con viruela o los otros individuos que califican, que ya han explicado los doctores.
Sorry, last one from me, I promise. Maybe, Mr. Brown, I know that you mentioned that vaccines were given out at a venue, but just this last question. So we continue to hear frustration from people and doctors about how clunky the process is. Are there plans to revamp that and make access and care more accessible?
Well, and I'll give an opportunity to Mr. Williams to answer in a moment, but what we're doing right now is to think, okay, if this gets bigger, if there's greater demand for vaccines, for testing, setting up the appropriate system for that, right? And so making sure that we can scale up. We have lessons that we've learned from COVID-19, and that's the work that's being done right now. And as you said, it's a balance, right? Because you offer it to everyone, but we only have this many doses, right? So we have to, we're sort of giving little by little as we receive more doses. But we're in communications with our FQHCs, we're in communications with our public health departments, we're in communications with the communities that are most affected, and of course between county and city, and always we're sending messaging to our doctors. There's a communication system that goes from the public health departments to the providers in the county, making use of that, as well as, of course, our congressional delegation, in the sense that we need their help to be able to obtain more vaccines.
And let me just say, what we learned from COVID is that when the demand is high and the supply is limited, people are very, very frustrated and critical. That was in COVID. Now what we're finding out with monkeypox, with all of the attention that's been brought to it, on the world scale, 16,000 cases, World Health Organization now naming it a public health crisis, which it is. The demand is very high, but the supply has been very limited. So it's frustrating when people want it, when they know it's a vaccine available, they want the vaccine. Medical providers, when they have the people calling them, they want to be able to tell them something. Yes, we have it. No, we don't, but we'll have it, by this time. But the supply has been very limited. And so when they're seeing what's taking place in New York, in D.C., in San Francisco, this is the 4th largest city, the most diverse. And up until Friday of last week, we were dealing with how many? About 300? About 300 for the entire Houston-Harris County. So that's frustrating. When you know there's a vaccine, nobody wants monkeypox. So that's very frustrating. And so now, as the CDC and the state has made more vaccines available, we can get it out a little bit more, but we need more. We need more. The good news from the designation by the World Health Organization is that it does put it front and center. This is a world public health crisis. And so hopefully the CDC and the state will be sending thousands of more vaccines to the Houston-Harris County area so that we can, as much as possible, get ahead and not have these numbers exponentially increase. But it's been frustrating. And I think my own people can tell you, I have been frustrated. Okay?
And I think people recognize that the supply-demand thing is obviously
Right.
certainly a problem. From what I'm understanding, and I apologize, I'm a little bit of a messenger in this situation.
No, you're good,
from
you're good.
Other reporters, but there's aggravation in terms of getting information, how to proceed, how to advise patients. I think that is an additional level.
And that's why the judge and I are standing together with all of these exceptional healthcare providers to try to provide more information, to at least to give the public what we know. Okay, because we can only give you what we know. And then to write a joint letter to the CDC asking for more vaccines. But that's one of the reasons why we wanted to come together, both Harris County, City of Houston, with some of our FQHCs, our medical experts, to provide as much information to the general public so that they will know we want to be transparent. We want to provide them with as much information as we can and to let them know that we are here advocating on their behalf, okay, to make sure that they get what they need even before they get the monkeypox. We just want them to know we're here for them. Okay?
Thank you all so much.
Thank you, Judge.
Thank you.
Appreciate you.
Thank you.
Thank you.
Thank you.